So good afternoon. I'm Dr. Murray Riker, Chairman and co-founder of DR Systems. DR Systems is one of the leading providers of medical image management and information systems for hospitals, imaging centers, and independent imaging providers, both radiologists and cardiologists, and we also distribute data for pathology departments as well. And I'm very happy to announce eMix. eMix, or eMedical Image Exchange, was the initial brainchild of our co-founder, Dr. Evan Fram, who's also a very well-known radiologist, neuroradiologist. And eMix stands for eMedical Image Exchange. eMix is a revolutionary new approach to allowing hospitals, imaging facilities, physicians' offices that have imaging capability, or frankly, anybody else that's got a medical record that they can print in Windows, whether it's a medical report or document, to interchange that information with all of the parties that I just mentioned. So it could be PACS to PACS data exchange. It could be PACS to PHR, to EMR, to HIS, to patient home, to remote doctor, to emergency room. eMix, unlike much of what you see here at the RSNA, is not capital equipment. It's a standards-based web solution. You become a subscriber to eMix if you want to upload information. The uploading of information is designed to be less expensive and more efficient than what is currently done today, which is typically creating a CD or printing or faxing a document and, or perhaps FedExing a CD or a DVD. It's a way to lower healthcare costs by allowing more efficient interchange of information between healthcare providers and their patients so that redundant exams are eliminated. And so it is a way of lowering healthcare costs for providers as well, who today are spending more money manually moving medical information around. And at the same time, it's a way of improving services to patients who can access information in their homes or know that their physician can access information. Again, eMix requires no capital investment. There's no equipment to install. If you've got a computer connected to the internet and it's got a browser on it or ability to receive email, you can eMix. And eMix is a verb. It's a highly secure method of moving medical imaging information and or other documents or reports across the web where they land and can be imported directly into another system. So let me give you some real-life scenarios of how eMix can work, and then I want to introduce my colleagues here. Scenario number one. You're a radiologist, you're working in an imaging center, and you're looking at a chest x-ray with some abnormalities, and you need to see the old chest x-ray. But the old chest x-ray was done 50 miles away in a hospital. Today, you might put that exam on hold, wait for a CD or films to arrive, and read it 3 days later. Or you might repeat an exam or do a CT that you might not otherwise need. With eMix, you can contact the facility that is the host of the old exam, ask them to upload it to the cloud, and in a very secure and confidential manner, you'll receive an email that lets you know that you can now view that exam. And you can also upload it into your PACS system if you want to view it on your PACS system. And very importantly, you can not only upload the exam, but you can upload the report, because eMix has developed a standardized method of rendering just about anything you can print with your computer as a DICOM image that can be packaged and moved along on the eMix cloud. So that's a common scenario. Another scenario might be a patient in an emergency room who has a headache, and they had a CT earlier in the day in a facility unaffiliated with that emergency room. The emergency room physician can request that the exam be eMixed. It can be uploaded to the cloud. ER doctor gets a email back a few minutes later, click on the hyperlink in the email, and they can access and view that patient's images. And yet a third scenario might be a patient in their home who had an exam last week, is going to another physician next week, calls your imaging center or hospital and says, you know, can I get that exam? You say, sure you can. All you have to do is drive down to the hospital, pay for parking, wait in my waiting room for a while, and I'll hand you a CD. Or alternatively, you can, I can send that exam to you via eMix, and for a small fee, you can receive that exam at home and view it, or burn a CD with your own images and reports, and ultimately even upload that exam to your personal health record, or ultimately work with eMix to store that exam for an extended period of time via subscription, where it might be available to any of your caregivers at a time in the future. So that's the overview of eMix, eMedical Image Exchange, developed by DR Systems, a well-known name in medical image and information management. And Bill O'Leary. Bill is the head of the IMOM project, or Imaging Movement of Montana. They are the first charter member of eMix and have successfully deployed eMix to move images between 3 hospital facilities. And just so I don't blow your thunder, Bill, I'll give you the microphone and you can explain to us what the Imaging Movement of Montana is all about and how you're using eMix already.
Thank you. We started a process probably 2 years ago to look at a way of transferring images, full resolution images, to different facilities. Our facility, Kalispell Regional Medical Center, has a very strong PACS and IT staff. We can set up VPN connections, but not on a fly. And that's where the problem has occurred in the past, is we can set up a VPN and transfer that data, but we need somebody on the other end to set it up on their end to transfer the data. Works well. Unfortunately, not everybody in the state of Montana has a strong IT staff or PAC staff to set those up on a regular basis. So things kind of get dropped. They burn CDs, mail them, and that was the process that Dr. Riker explained. CDs get there, they're great, but they take a lot of money, FedEx charges, and it could be 3-4 days before they receive them to put them in their packs and read the exam. So we started the IMOM project approximately 9 months ago to look at a way of a solution to resolve that. We wanted the images moved faster so that patients didn't have to have their exams repeated, didn't have to pay extra for those exams, or sit and wait to get a diagnosis because they're waiting for their CDs to reach the physician. With the IMOM project, we looked at multiple vendors and talked to them about could they help us with a solution. DR came out on top with their eMix product. We've been beta testing it recently. It is working fabulously. We have 3 different facilities, 3 different PACS vendors in there, all using it and moving images and reports between the 3. When we started the process, we went to Montana Hospital Association and asked them to help us come together and put together a survey to survey all the hospitals in Montana to determine what the needs were. We had, out of the 54 hospitals in the state, 30 of them responded. We had a huge amount of disparity. Probably 76% said that they would like to set up VPNs or transfer data that they weren't able to when they wanted to. So that's kind of where we started with building a survey to understand what the needs were in the state. And knowing that and the cost of some facilities spending $30,000 to $40,000 a year just in FedEx charges. Our facility was one. I think we spent about $28,000 a year. And we weren't getting exams to where we needed them to go, even though we have VPN set up at probably 28 different sites to send data. We still have patients leaving to go to their doctor's office, out of state. We're kind of in a resort area in northwest Montana, so we have a lot of visitors in the summer that they want their images when they leave. Burning CDs is what we've been doing.
I'll add one other comment first, or a couple other comments.